Welcome to You and Your Pets. I'm Jim Horton. We're here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And we have a special guest tonight. Dr. Rogers, would you introduce our guest, please?
Thank you very much, Mr. Horton. I'd like to introduce Dr. James Anthony. Dr. James Anthony is a guest here in New Jersey and works through the Red Bank Veterinary Hospital as a veterinary dentist. Great. He's a very accomplished dentist, and I've had an opportunity to look at some of his work. It's fantastic what he does. He's actually Canadian, so you're outnumbered today. And he is from Vancouver and works both at Red Bank Veterinary Hospital here in New Jersey and has practices that he works in Canada.
Very good. So tell me, I know absolutely nothing about animal dentistry.
Yes.
What kind of background did you have to have in order to do it?
Well, you have to be a veterinarian first. So you go through 4 years of veterinary training, and then you specialize afterwards. Now, I'm one of the pioneers, so when I first started, there was no specialization in college. So I had to, start from the scratch and learn right from the ground up and develop a program. In fact, we develop programs throughout North America at the vet colleges, where now we do have residency programs.
I think one of the interesting points is that one of the fathers, as well as Dr. Anthony, one of the fathers is a gentleman by the name of Dr. Peter Emily, who's actually a human dentist who worked with the veterinarians and veterinary dentists to establish the college, the American College of Veterinary Dentistry.
Oh, for heaven's sakes. Tell me, how do you compare human dentistry with pet or animal dentistry? You use the same tools pretty much, right?
We use the same basic tools. Some tools are specialized because some of the teeth that we deal with in some animals are really big, like lions and tigers and those types of things.
Bears, oh my, yes.
Exactly, whales and those things.
Killer
elephants.
Whales, yeah.
I've worked with elephants and whatnot, so you use things like Black & Decker drills.
Hacksaws.
Bottom line is, it's the same materials, same principles as in human dentistry, but we have to do minor adaptations to actually facilitate the equipment to fit the animal's need.
Okay. And you're board certified in North America, that's U.S., Canada, and also in Europe, is
Yes,
that correct? What's the differences between Europe and North America?
Oh, a big ocean is in the between.
But get wet.
That's right. It's virtually the same. Maybe about 5 years ago, there was a big difference, but they have caught up so quickly that really they're on the same level as we are over here in North America.
Are the drugs available and the materials available over there the same as what we have here, or do they have different?
They have the same materials, same drugs, different names. And in some cases, they have better products than we do, and in some cases, worse products than we have. So it balances out.
Right.
But with the way free trade is these days, it's not a problem getting anything from anywhere from North America or Europe.
So we mostly talk about dogs, cats, and horses on this program, but I understand you have done some very unusual animals in your time. Could you kind of give a description of what you worked on?
Sure, certainly. I've worked on pretty well nearly all of the animal species that have teeth. I've worked on as small as a vampire bat, which is like an inch big. I did a root canal on that.
For heaven's sake.
It was a zoo bat, but you got to realize they have to puncture some latex that's full of blood, so they need their canine teeth in order to do that. Without that, they would starve. So that's why we did a root canal.
Gee.
And then I've worked on killer whales.
You've worked on killer whales.
Yes, elephants, hippos, rhinos, camels, dolphins. The only animal I don't do are snakes. I have a bit of a phobia, I guess.
And you've done monitor lizards?
Monitor lizards, Commodore dragons, even tarantulas. So
That's right, they do have to.
Well, now you described briefly before we came on the show and how you worked on aquarium animals. Could you just take us through that? Because I thought that was really amazing.
Well, with some of the larger animals that we cannot anesthetize, such as a killer whale, you have to train it to trust you. So what we did was we had a big piece of plywood that the whale would get out of the pond or little aquarium and lay its head on there and open its mouth. for an extended period of time. In this case, it was about 10 minutes. So we would do 10-minute intervals of treatment and then basically do another session another day. And we did several of those in order to get things done. But the first thing is you have to gain that animal's trust, because believe me, when you're in front of a killer whale's mouth, you feel like a fly in front of a frog.
Well, you could be a dinner.
Yes, absolutely.
Okay, how often do you recommend that a dental exam and prophylactic dental cleaning be performed for both dogs and cats?
I would recommend that when anybody brings their animal into their veterinarian for a wellness exam, that an oral exam be part of that. And as a result, every 6 months should be an evaluation. Doesn't mean that they need to have a teeth cleaning every 6 months, but an evaluation.
Okay. And what signs should owners be aware of in assessing whether their dog or cat has a dental problem? That's not easy to tell necessarily, is it?
It's not easy to tell, mainly because people don't look in their pets' mouths that often. And as a result, out of sight, out of mind. If they realized how really bad things were in the mouth, they would actually take their animal racing to their veterinarian to get treated. But unfortunately, a lot of times it's overlooked. And then we see it at an advanced state, and it ends up costing a lot more than what it could be something very simple. Right. So with the valuations of these animals, the first thing that I would recommend that people look for is bad breath. Bad breath is a sign of dental disease. Second of all, not chewing properly. But more importantly, if they were doing home care, they would see something going on in the animal's mouth and bring it to the attention of their veterinarian. So home care is absolutely essential. If a person does home care on their pet's mouths, there's a very good chance that that animal will not need any dental procedures ever in its life. You know, short of something traumatic or something like that.
It snaps a tooth doing
exactly.
something. Yeah.
But for periodontal disease or something like that, or gum disease, basically that's all preventable. And if people did home care, I mean, just think of your own mouth. If you did brush your teeth twice a day, never mind ever, your mouth would be a cesspool. And that's what's happening with the dogs and cats.
As I tell my clients, you brush your teeth twice a day, you floss at least twice a week, and you see your dentist every 6 months, twice a year. Mm-hmm. So what do you think of what's happening with your dog's mouth when he doesn't floss, doesn't brush, and doesn't see me?
Absolutely. And the thing is, home care can be so easy. Your veterinarian can customize a home care regime for your pet, for your pet and for the owner, because not everybody can brush their pet's teeth, and you don't have to brush the pet's teeth in order to get success. There's many, many products out there now that basically are tremendous aids in helping plaque reduction. You know, a couple of examples would be water additives, put it basically as for plaque control, such as Healthy Mouth. There's also products that control inflammation, such as 1-TDC, and dogs love it. Other things such as chlorhexidine rinses, which decrease bacteria in the mouth and subsequently plaque, and the list goes on with chews, dental diets, those types of things. And that's why it's important to talk to your veterinarian about preventative care, because that is the key. If you don't do preventative care, then unfortunately I'll have to see people like you know, that will have the consequences of lack of care.
And I think, I think one of the things that we find is that when I talk to my clients, I tell them every patient is different. The biochemistry of the mouth, the food you're feeding them, and the care they get is a triad of how it comes together and how well your animal's going to do. Some dogs are very lucky, and you see them year after year with very little dental or gingival or gum disease. Other animals you see, and for whatever reason, they're 2 years old and their teeth are falling out. And it's really the biochemistry of the mouth along with the food, along with the care. Do you agree?
Absolutely. I think a lot of it is also the immune complex, or the way the animal can fight off infection. And some animals are what we call immunodeficient, so they don't have enough things in the body to fight off infection. And as a result, will need a little bit of extra help. People are the same way. Some people need to have their teeth cleaned every 3 months or every 2 months. Others don't even need to have it done after 5 years.
right.
I wish I was one of those, but that's not the case. So everybody's different, just like every animal's different. That's why it's got to be basically uniquely designed to meet the animals and the owner's needs.
So you mentioned bad breath as being one of the indicators, but what should a pet owner do in the home? Should they pull the skin back on the jaw and check the teeth that way on a regular basis, or just simply observe, or what should be the procedure that every pet owner should do? I know we don't do it for our dog, although his teeth I think are okay because you checked them.
Oh, they're great.
Now you're in trouble.
It depends on how friendly the dog is and the relationship between the pet and the dog, or the pet and the cat, or the pet and the monitor lizard. There has to be a relationship there for it to work. But I think Dr. Anthony, once we assume that there's a good relationship, then I think Dr. Anthony has some.
If it's safe for the owner to lift up the lip and that the dog's not aggressive or the cat's not aggressive, it would be a good idea to basically have the owner look at the mouth maybe once every few weeks and see if there's any change, such as discoloration to the teeth, broken teeth, little lumps and bumps. And we have some pictures later on that we can show and explain those things, what to look out for as well.
Yeah, those pictures are, some of them are
Challenging,
eye-opening.
yes.
They might not be a program that someone wants to watch while eating dinner.
No.
But if a dog just suddenly starts bleeding from the mouth or something like that, you have a major problem.
Absolutely. They need to be seen right away. I mean, there could be a laceration of the tongue, could be a laceration of the gums, the list goes on, and there's some very big arteries there that they can lose a lot of blood.
And I think one of the things that we recognize with dogs and cats is that if we watch them chew, and when animals come into my clinic, I give them a treat. Everyone thinks it's to make them a friend, but it's to see them chew. There's no way I can assess whether or not they can swallow, chew, and hold food in their mouth without giving them a treat. And so that's something that the owner can do. Watch them chew. Don't give them their food.
If they don't chew, there's some discomfort, or if they just chew on one side, they're basically just on discomfort on the opposite side. And if they look carefully at the mouth, they'll see one side of the mouth has a lot of discoloration, such as calculus. The other side would be clear. So-
Okay. Well, we're just about ready to take a break, and so when we come back, we will look at some of the mouth diseases that you treat. And I would caution our viewers that some of them are interesting, and you might not want little children looking at the screen. But we'll be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets. I'm Jim Horton, and we're here with Dr. Ernest Rogers, our resident expert, and Dr. James Anthony, our guest tonight. And Dr. Rogers, will you take over now and go through some of the dental diseases that you have pictures of?
Some of the horrible diseases
Some
that
of
we
the
have
horrible
pictures.
diseases.
Yeah, I think one of the things I want to make clear to our audience is that Dr. Anthony is not only a veterinarian and a dentist, he's a specialist. And we respect that as veterinarians. There are a lot of things that I can do and many things that I choose not to do because Dr. Anthony will do them so much better than I can. I think what we're going to start off with is just see Dr. Anthony in his practice here. And what we see is Dr. Anthony is wearing a face mask and goggles because the mouth of a dog can contain bacteria that we aren't expected to be able to fight off. And in many cases, we can have a problem. So, Dr. Anthony, this is under anesthesia. Can you describe that? None of us work as an individual, so we all have a team. So if you'd just like to give us a quick description.
So I'm sitting down working on the patient, and beside me is, on my right, is basically a technician, an animal health technician, two of them. One is monitoring anesthesia only. So we have a whole bunch of machines there that are hooked up to the animal, monitoring oxygen, temperature, carbon dioxide, blood pressure, all those things. And then we have another technician there that's aiding with me with instrumentation and basically passing products and all the instruments, those types of things. So my fourth hand, basically. And with there, basically you can see the drills, you can see that it's the same equipment that you would see in your veterinary, I was going to say your veterinary dentist, your own veterinary dentist, but your own dentist. So we use similar equipment, as you can see there. The only difference is, unfortunately, we do have to have them anesthetized in order to do a proper job.
And so there's been a number of lay articles on non-anesthesia dentistry. And having done much dentistry, I mean, I've been doing this since I was a veterinary technician. I don't see a way to do it. I don't think the American Veterinary Dental College suggests that it can be done effectively. What's your opinion on non-anesthetic veterinary dentistry?
Well, I feel it gives a false sense of security to the owner, because what is happening is the individuals are cleaning above the gum line. You got to remember, all gum disease starts beneath the gum line. So they're missing the boat. So what I've seen is some beautiful looking teeth, but when we take x-rays, they got so much disease underneath, and I've got about 50 cases of non-anesthetic teeth cleans that were done that I've ended up taking out over 30 teeth of these animals.
Right.
So it's a false sense of security, and you cannot clean underneath the gum line properly, maybe in about 0.1% of animals, okay? I won't say never, but it's very rare that you would get such a cooperative patient.
Okay.
So, Dr. Anthony, let's just move on here to a disease. Now, this is actually one of my patients who was in recently. It's a cat. And would you like to comment on the disease, the black teeth, the gingiva?
This is very severe periodontal disease. This is pretty well the worst it can get, almost, where the gums have receded because of gum disease. All that brown and yellow stuff, the brown is calculus, which is solidified plaque. Plaque is the material that you feel on your teeth in the morning before you brush your teeth. And basically, you brush that off, and it's very easy to brush off, same in animals, but once it becomes calculus, it's very difficult to remove. And then what happens is it destroys, causes inflammation, and the inflammation causes destruction of not only the gums, but also the bone, which is supporting the tooth. And as a result, we have loss of the teeth as well.
And so if we move on, we see another common thing that I see. We call them neck lesions. You call them reabsorptive lesions.
What these are basically lesions that have occurred because of periodontal disease. What periodontal disease does is it activates certain cells in the body called osteoclasts that actually start eating away at the tooth. So it reabsorbs it. And it's all due to gum disease. So if you did preventative care, these would not happen. These are extremely painful. Yeah. You touch one of these, the cat will hit the roof or try to eat you.
Right. And it's interesting because I really only see it in cats. I've never seen it in dogs.
They are in all species, but more commonly in cats. Why it's more common in cats, we do not know.
And so this is another cat picture, and you can see how red and angry those gums are. And this is a situation, another case that I've had of mucositis, or a reaction of the gum to the teeth and the plaque.
Basically, it is a reaction of the body to plaque with inflammation. And it's a severe secondary effect from periodontal disease. And basically with these animals really suffer a lot. They drool, they go off their food, they hate anybody trying to even touch their mouths because they're suffering with this. And it's a very, very painful situation for them. It can be controlled if caught early enough, And basically, we usually get them too late, unfortunately, and it usually ends up where we have to take out all the teeth, which is not really what we want to do. This is a case where we actually did extract the whole mouth. And basically, it was even worse than that case before, where it was just so red and raw that basically these teeth we could just pull out, but then we had to curette underneath and get rid of all the rotten bone and tissue there as well to facilitate healing.
So how do these animals eat once you remove all those teeth? Do you have to do implants?
We could. I wish a lot of people would want us to, but that's not necessary. Basically, you can still survive without your teeth, but you have to just have soup. And very similar to these animals, they'll have to be watered down, kibble or dry food that is very soft. So basically foods that are easy to lap up. So yes, it would be nice to save teeth because really they do need them, especially if they're outdoor cats, because the canines are their major defense mechanism. But again, it's one of these balancing acts. Do you leave them in pain and suffering, or do you take out the teeth and make them healthy and comfortable? Make them healthy and comfortable and modify their behavior, meaning that they become indoor animals and protected.
Okay.
It's interesting, when I was a PA at a psychiatric hospital, I worked on the Alzheimer's floor.
Oh, yes.
And a lot of the Alzheimer's patients would take their dentures out to chew steak. So you can survive without it. This is now we're into typical dog, well, not typical, hopefully, but I often see this kind of mouth from a dog. This is one of our worst pictures, where the gum has receded, there's plaque on all the teeth, and this is about time for extraction.
Unfortunately, all those incisors, the front teeth, do need to be extracted, just looking at it. But the canines we probably could save. Now, the cause of this, though, is this animal is predisposed to gum disease because it has a malocclusion. In this case, the lower jaw is slightly longer than it should be, and as a result, the normal interaction of the teeth is not there. It's where the bottom teeth should be behind the upper teeth. These are in front here, and as a result, the natural cleansing motion that would occur normally to a certain extent in dogs with normal mouths is not there, and plaque accumulates, and we get calculus disease.
Is it true that some breeding, like say on bulldogs, they actually are creating dental problems in how they're being bred?
Absolutely. Unfortunately, that's the case. I mean, I love bulldogs, don't get me wrong. I think they're adorable and wonderful animals, but unfortunately, with the severe undershot condition of their mouth way out, that predisposes them to a lot of dental disease. And it's one of the breeds that we do see a fair amount of.
Okay.
God's gift to veterinary dentists, I guess. And then we have another one. Now, this is something I see quite often, especially in young animals. This is, if people can see it on the screen, there are actually two canines on each side, which is a little bit unusual, and that's called?
Well, there are two canines. One is a baby tooth, the one on the outside, and then the adult tooth, which is on the inside. When we get a retained baby tooth, what happens on these canines, on the mandible, is they erupt just towards the tongue. And what's happening here is those adult canine teeth will be hitting the roof of the mouth, and I've seen it where they've actually penetrated right into the turbinates of the nose.
Oh my heavens.
So this can really be a severe problem if not addressed soon. Very easy to treat, though.
So we're going to be running short of time here pretty quick. So
I think what I'd like to do is go right through to something that's very impressive that you've done, and that's an implant. And I think we can get through this in about 30 seconds.
Yeah.
Basically, if an animal does lose their teeth, we can place artificial teeth in, such as implants, to retain function and integrity. They're not nearly as expensive as they are in humans. They're still not cheap, but it's not nearly as costly as in humans, and they work.
And this happens to be Dr. Anthony working on a tooth, putting it in place, and as you can tell, it's silver. And this is the end result. a little bit formidable with 4 silver.
Well, this is not implants here. These are crowns.
Oh,
So we
crowns.
did root canals on these teeth and then protected them with crowns. This was a police dog, and basically it's a working dog to protect the teeth, because without a canine tooth, with a police dog is like giving an officer a gun without bullets.
Right.
So they need that.
Okay, how many veterinary dentists are working in North America today? Are there a lot of you, or is this still pretty much a specialty?
It's still it is a specialty, but we only have a few veterinary dentists so far still. We hope to get a lot more in the near future. Right now, there's about 130, just over 130 veterinary dentists in North America. So it has improved, but we still need a lot more.
Okay.
And if,
Dr. Anthony, we've run out of time, so
Well,
I'm going to want to thank you very, very much for taking the time to talk with us. And
if there are any questions of our audience who would like to get some information, feel free to write me at maplewoodah@comcast.net. An email will help, and I'll try and get the answers for you.
well, thank you very much, both of you.
Thank you.
I'm Jim Horton. Thank you for watching.